it's a very complex answer to all of our problems, but certainly one that we can address is how can Phoebe keep us from being so sick before we get to you?
So, those are great questions, and I would agree at the national level there is so much chaos that is, whether it's intended or not, it is there. And you got to remember that 70% of everybody, from a healthcare standpoint, is either they have Medicare or they have Medicaid. Maybe they don't have insurance at all. And so when you have chaos at the state level or at the federal level or both, it's gonna be chaotic throughout those benefits, those systems. And we're certainly feeling that as we think about Medicare and Medicaid. And sometimes we don't make it easy. You know, maybe you've heard of Medicare for all, and that can be a sensitive topic, depending on if you're talking to a Republican or a Democrat. I'm a believer in Medicare for all. Medicare and Medicaid are really just two systems that operate in their own silos that administer benefits in the exact same way. They have the same provider lists, and so what we've caused or what we've created is an economy of jobs and of expense. We want to talk about how we reduce the cost of healthcare. You have one government-related system, whether it's Medicare, whether it's Medicaid. People have talked about the VA. I'm sure we have some veterans in the room, and thank you for your service. But the VA is one of the more difficult systems to access healthcare in. But we continue to struggle with it, but in the end, Medicare provides the exact same services that the VA and TRICARE provide. It's just we do it separately, and TRICARE is a lot more complicated. And so I think we can, at the national level, and as we think about it, that we can provide care in a more streamlined fashion that would reduce costs and would make it better for anyone with those benefits. I think the question you asked about how do we help people before they become sick? And it is, if y'all have that answer, bring it up. We're going to be zillionaires. That is complicated. It's not easy. What I'd say is stop eating donuts. Stop eating candy bars. I just had a candy bar before I came here. I love donuts. Stop smoking. Stop doing drugs. Stop drinking alcohol. Stop speeding. What else? Right? All those things we love as Americans to do. Somebody had told me this one time. Americans want three things. I added the fourth. Americans want the best health care in the world. They want it now. That's the one I added. They want somebody else to pay for it. And the fourth is they're usually unwilling to change their own behavior to treat their own, to better have themselves have better health. Right? Look, you see up here a slightly overweight man, maybe more than slightly, right? But at one time in my life, I was 340 pounds. Right? I lived that way for 53 years. Right? I knew better. I'm educated. I knew what it was. So I'm not saying that's easy, right? But how do we improve our health? How do we help you do that? We have ways that we do that, right? Our health screenings that we come out and do, Project Elevation that the pastor talked about, isn't just about screening in the moment, but it's about educating people of why annual screenings are important, especially for men who are just hard-headed about a prostate exam, about immunizing children. And we talked about what's going on at the national level, about immunizations, and how we've caused this chaos. And now we heard this morning, right, we got this measles outbreak in South Carolina. And the United States is on the cusp of no longer being considered a nation that has eradicated the measles. And we talked about flu shots and COVID shot vaccines and all these child immunities. Are we willing to do that? If we don't immunize our children, we are going to have more disease. That's my opinion, right? And again, we all had different opinions. Got one of our community pediatricians here. She can probably tell us better than anyone. So, Ms. Gaines, I hear you. Our system is backwards, right? Payment is for taking care of sick people, not keeping people healthy. It doesn't mean we don't have a responsibility, but if we can somehow flip that, but I don't know how we flip it when we got fast food on every corner. We got convenience stores that, right, provide so much, are selling tobacco and alcohol and lottery tickets, right? I don't know how we fix all that, but our goal is to try to bite off a little bit. It's eating the elephant. You got to eat it one piece at a time. So I don't have a great answer. I don't have a perfect answer. I think if you've got ideas, we're all ears.